So topic for today is surgical outcomes of patients in resectable non-small cell lung cancer. Basically the NEOpredict-Lung trial, which compared Nivolumab plus Relatlimab versus Nivolumab as a phase 2 study. So, and this was presented in ASCO this year and was also presented in ESMO in 2022. So I'll be discussing the ASCO slides. So just to give a little bit background, we know that neoadjuvant perioperative immunotherapy, there are feasibility and safety studies, now even the efficacy studies in the resectable non-small cell lung cancer. But beyond that, beyond PD-L1 and CTLA4, other inhibitors like LAG-3 inhibitors are also in the pipeline. And the preoperative immune checkpoint inhibitors provide a window for early response assessment, and there is a correlative biomarker research on these molecules which are going on. And this is the first experience with Relatlimab plus Nivolumab in resectable NSCLC. So this was just to give a brief idea about the study design. They explored the feasibility, safety, and the early efficacy of the combination regimen. Nivolumab plus Relatlimab, and as I have said, Relatlimab is a monoclonal antibody against LAG-3, and the reference arm was Nivolumab, with the primary study endpoint was the feasibility of the curatively intended surgery within 6 weeks, and the secondary endpoints were radiological and histopathological response rates, DFS and OS at 1 year, and the R0 resection rates. So this is the study design. They randomized in 2 arms, Nivolumab versus Nivolumab and Relatlimab, and they had other arm also of the dose escalation. So this is the patient characteristics, well balanced, with a median age of 65 years, mostly adeno and squamous carcinomas, mostly stage 2 and stage 3, and PD-L1 was 24%. Patients had a PD-L1 positivity. This is the surgical approach. You can see the almost half of the patients had a central tumor location, and majority underwent lobectomy, and a little bit rare, few patients underwent bilobectomy and sleeve lobectomy also. 60% of patients could undergo minimally invasive surgeries. Operating time was fairly balanced, with a good number of lymph nodes could be resected, and the perioperative complication rates were in fact numerically higher in the Nivolumab arm as compared to the combination arm. Coming on to the perioperative complications, were mostly similar, and there were no major differences in the complications in the both arms. Coming on to the IO treatment related adverse events, as expected, we did see a lot of immune related adverse events like hypothyroidism, as well as transaminitis, but there were no new safety signals. Coming on to the histopathological response rates, you can see the PATH-CR rate was 13% in Nivolumab arm, which was slightly higher in the combination arm, and also the major pathological response was higher, numerically higher in the combination arm. Coming on to the radiological and metabolic responses, here the combination arm had better post-operative responses as compared to the Nivolumab arm. T3 tumor in the preoperative stage was downstage to T1A in the post-operative in the Nivolumab plus Relatlimab arm, versus minor response in the Nivolumab single agent arm, with a pathological response of 30% or 70% reduction in the tumor cells as compared to only 20% in the single agent arm. So coming on to the outcomes, there was no 30-day mortality in either of the arms, and the 1-year OS and DFS was 96% and 91% in the both the arms. So this is just to show the graph of the overall survival and disease-free survival. So just to conclude, the primary study endpoint was met by all patients in both the treatment arms, and minimally invasive surgeries as well as open techniques were safely possible despite the use of immunotherapy, and there were no increased risk of complications or vascular sleeve resections. And the perioperative cause, the morbidity, the mortality were all comparable as compared to the conventional neoadjuvant regimens. And further studies, the biomarker studies are ongoing, and the protocol has now been amended based on the safety analysis to explore a higher dose of Relatlimab for increasing the LAG-3 target occupancy. Thank you.